And it's day 85 of Israel's war in Gaza. And here is how things stand there. Israel's bombardment of southern Gaza has intensified, with the Israeli army, navy and air force targeting multiple locations in Khan Yunis and Rafah. Israel has also hit residential areas and civilian infrastructure, resulting in a large number of deaths. Now, according to the United Nations, between Thursday and Friday afternoon, 187 Palestinians were killed and 312 wounded in these attacks. We have details of this in this report.
Fierce Israeli tank fire and airstrikes have been continuing in Khan Yunis in southern Gaza, which Israel sees as a stronghold of Hamas. Residents have reported intense gun battles between Israeli troops and Hamas fighters there. The Israeli army says it struck targets across Gaza over the past 24 hours, and its troops have killed dozens of terrorists in Gaza City. As Israeli ground operations drive tens of thousands of people to flee, there are reports of an increased spread of diseases. The United Nations has complained that the volume of aid reaching the territory remains woefully inadequate. Israel insists it is not limiting it and that the problem is with its distribution. And as people continue to be massively displaced across the south of Gaza, with some families forced to move multiple times and many sheltering in overcrowded health facilities, the World Health Organization remains very concerned about the increasing threat of infectious diseases. Since mid-October until mid-December, people living in shelters have continued to fall sick. Close to 180,000 people are suffering upper respiratory infections, 136,400 cases of diarrhea, half of these among children aged under 5, 55,400 cases of lice and scabies, 5,330 cases of chickenpox, 42,700 cases of skin rash, including 4,722 cases of impetigo, 4,683 cases of acute jaundice syndrome, 126 cases of meningitis. The WHO and partners are working to support the health authorities to increase disease surveillance and control by supplying medicine, testing kits to support prompt detection and response to infectious diseases such as hepatitis, and trying to improve access to safe water, food, and sanitation services. In the meantime, South Africa has filed a case at the International Court of Justice alleging that Israel is engaging in genocidal act in Gaza. The UN court confirmed the proceedings concerning alleged violations of Israel's obligations under the Genocide Convention. Israel has strongly rejected the allegation, calling it baseless. The Foreign Ministry said, quote, "Israel rejects with disgust the blood libel spread by South Africa," end quote. Following its application to the ICJ, South Africa's presidency said in a statement that the country was obliged to prevent genocide from occurring.
And for more on the humanitarian situation in Gaza, medical doctor, college professor, healthcare researcher, and a rights advocate, Dr. Perry Bremer, joins me on the World Now. Good to have you join us on the news at this time. Let's begin with some of your greatest health concerns as a medical practitioner about the humanitarian crisis in that region.
Thank you very much for having me. It's a pleasure being here again. And hello to everybody around the world listening and watching. It's sad to see that so far in we are this tragedy is still ongoing. Preventive health is a mainstay of healthcare globally, and the incapacitation of the medical facilities in the tiny, most densely strip of land on earth. I think Gaza is probably the most densely populated strip of real estate, combined with, you have an incapacitation of the health care delivery system to provide preventive care, And then you have the continued bombardment. This is a toxic combination that, actually potentially leads to more deaths than, happening from the bombing. So like, you mentioned in your report, we have over 150,000 cases of respiratory infection. So infectious diseases keep rising. And with the, diarrhea, all these other conditions keep rising. And these potentially kill, especially when you cannot get the right medication and, even clean water. From what we hear, they have probably begun flooding the tunnels in Gaza. And when you flood these tunnels with salt water, you're going to affect the water table. So the limited, potable water is even going to go down to next to nothing. So this is an unprecedented humanitarian crisis, like you rightly said. And without access, without the safety guaranteed of even, medical, personnel, their safety is not guaranteed. And then, there's limited health resources that are flowing into the region. The catastrophe is just going to get worse, and there's nothing the medical community can do.
I understand you perfectly, Doctor, but with the number of aid that is usually being reported daily that is sent into Gaza, is it enough to contain the situation at this time? Looking at the record number of infectious diseases.
Yes, it's not nearly enough because you hear of the trucks that line up at Rafah border. And they only allow, let's say, a little percent to come in. When you talk about just water, there's not enough water, drinkable water, not enough medication. So they're only allowing, the last time I was on the show, I said that what's happening is, Israel doesn't want them there anymore. So everything is being, funneled to a very tiny amount that's not nearly enough. So the people get frustrated and, there's no option than, to be able to get out to maybe to Egypt or somewhere. It's not nearly enough coming in for, any kind of remedy to this healthcare disaster.
Let's talk about the safety of health practitioners like yourself. Have there been any, moves to contain the situation to ensure their safety? We have reports where hospitals are the most hit, and this has been the target of the war since this war began. Have there been any plans to, contain the situation or take them out of this?
Not till today, December 30th. There has been no, nobody is safe. No institution is safe at this point. So, like, hospitals have been targeted. Doctors, there was this horrific video where, neonatal patients were left in the NICU, intensive care unit, and, you leave, babies on respirators and, and incubators, there without any health practitioners able to attend to them. So, when you think of, maybe the crisis that, for instance, we have in Nigeria on steroids, they're talking about, power supply. Without power supply, you cannot, operate on patients. So power supply is limited, clean water is limited, professionals are being targeted, so they themselves cannot provide that health care. It's a crisis that there's no remedy to it, at this point. You cannot solve a crisis if you cannot attend to the patients due to your safety. So many physicians and health practitioners have been killed. So if your safety and then the availability of the materials and tools to use.
We're bringing you back to the WHO's concern about the increasing threats of infectious diseases. Let's take it to, foreseeing the aftermath of this war. Is it possible for Israel to, or for Gaza itself, to recover from the number of deaths, the number of civilian casualties at this time? Well, if you can hear me, I was talking about the fact that the World Health Organization is concerned about the increasing number of infectious diseases. Is it possible that Gaza recovers from the aftermath of this war looking at the number of diseases, the number of deaths, and all forms of casualties?
Firstly, like I mentioned earlier, at least right now, North Gaza has been pretty much annexed. So it's one of the most densely populated places, and half of it is already occupied by Israel. And we don't, 80% of buildings have been demolished. So we don't see a return to North Gaza of the people. And now South Gaza is being attacked. They said Khan Yunis. They said Israel claims that Hamas is in Khan Yunis now. So, they pushed everybody down south. So just in terms of human population and existence, and there doesn't seem to be an end at this point. It's going further towards, there doesn't seem to be an end at this point. It's continuing into 2024. So there's no, to draw a roadmap when the bombardment hasn't stopped, to draw a roadmap into survival for Gaza at this point, there's none at this point. I don't see a roadmap.
All right. Well, I've been speaking with healthcare researcher and rights advocate Dr. Perry Bremer on The World Now. Thank you for joining us at this time.
Thank you. My pleasure. Once again.